This is the case of 12 years female from Thrive with the diagnosis of lymphatic filariasis. Hello guys, myself Dr. Akshay Kumar Chaudhary. Today I have come up with a new medical video about the lymphatic filariasis. As you see in this picture, well, first of all, what is lymphatic filariasis? Lymphatic filariasis is a parasitic infection caused by a thread-like filarial worm that affects the lymphatic system. It invades and destroys the lymphatic system, leading to the obstruction of lymphatic system, and subsequently there is the swelling of the extreme parts of the body. Well, what are the causes of lymphatic filariasis? So it is primarily caused by three species of nematodes, that is roundworms. So first one, the most common one is a Wisteria bankrupti, and another one is a Brugia malaya, and third one is a Brugia tumori. So these parasites are transmitted to the humans by the mosquito bites, most commonly by the Culex mosquito, and also the Anopheles and Aedes species. So now let's talk about a little bit about the life cycle of parasite. Mosquito bites an infected person and ingest the microfilari. Inside the mosquito, they develop into the infected larva. When the mosquito bites another uninfected person, the larvae enter the skin and migrate to the lymphatic vessels, where they mature into the adults and causing the obstruction of the lymphatics and inflammation. So we usually get two phases of the lymphatic filariasis. When there is the acute phase, we'll encounter the symptoms like fever, lymphadenitis, lymphangitis. Similarly, in the chronic phases, we encounter lymphedema, that is the swelling of limbs or genitals, and elephantiasis, whereas there is the thickening of skin tissue, usually in the legs or scrotum. Similarly, hydrocele, that is the fluid accumulation in the scrotum, especially in men. Recurrent secondary infections. Well, talking about its diagnosis. So diagnosis is usually made by microscopy, that is the detection of the microfilari in the night blood samples. As the organism, that is parasite, is nocturnal, we take the blood sample of night. Antigen detection test, ICT cards for W, that is Wisteria bankrupti. Ultrasound may show the filarial dance sign, that is the moving worms in the scrotal lymphatics. And also we can do the serology and PCR in some cases. Talking about its treatment, so drugs basically we use for the treatment of the lymphatic filariasis is DEC, that is diethylcarbamazine, that kills the microfilaria and some other forms. Ivermectin, which mainly kills the microfilarial worms, because this is a microfilaricidal. Also, we can use albendazole, often combined with the DEC or ivermectin. Similarly, the management of the chronic diseases can be managed in the way like hygiene, skincare, exercise to manage the lymphedema, and even we need the surgery for the hydrocele and the prevention of the secondary bacterial infections. Similarly, the prevention can be made by the vector control, that is the mosquito nets repellents, and mass drug administration in the endemic areas where there is the most cases of the filariasis. Similarly, the health education. This is all about today.